which is a key quality not only in advocacy, but also in all types of actions in support of rare diseases. This is clearly demonstrated by the joint recipients of this year's EURORDIS European Rare Disease Leadership Award. They are Enrique Terol, Victoria Hedley, and Birutė Tumienė. The award recognises their outstanding work to launch and develop the European reference networks. We heard about those earlier from Avril. Before we hear from them, let's watch a short video about the networks.
My name is Ilaria. I've been coping with systemic sclerosis for about 25 years. So when I got the diagnosis, I was pretty young. Rare diseases have few patients, but we have to consider that in Europe, more than 30 million rare disease patients live. So we are a lot of people. The European reference networks are different because it's not just one doctor. It's a pool of doctors. And usually patients have to travel a lot, also abroad, out of the national borders to receive a diagnosis. With the European reference networks, it's not necessarily to travel anymore because there is a virtual platform and the doctors belonging to the reference networks, they could enter the data on this very, very secure virtual platform and ask the cooperation of their colleagues spread around Europe. So it's the information that travel, not the patient.
Let's now hear from the awardees, starting from Victoria Hedley, telling us about her purpose, why she started working in rare diseases, and why this has been her role in the ERN's story.
Thank you, Carrie. My purpose. I started working in rare diseases firstly because I have a relative with a rare disease, but more than that, I wanted to work in a field where I could feel that day to day, the work we were doing was going to have some meaningful impact for the people who need it, for patients and families. And I was really shocked at first to learn the scale and the extent of the challenges facing our collectively huge population. My role in the ERN story began when I joined the team at Newcastle. On my first day, I was assigned to the ERN portfolio. That was a big part of my life for many, many years. And my role was really to help develop the concept of what an ERN should be and should do, to support that first call, and then to have the opportunity to get to know and to work with the 24 amazing individuals who came forward to lead those networks, and to work with them to identify good practices, things that we could take forward into the ERNs. So it's been a real pleasure to be part of the ERN story so far. The ERN concept means a great deal to me personally because it is a wonderful example of what can be achieved when you collaborate across borders, across stakeholder groups. And that message of cross-border collaboration, of not being able to do it alone, is something which is personally very meaningful for me in these challenging times. So I want to thank EURORDIS and the Black Pearl Committee for this award. It's a real honour for me. And I would like to ask one of my co-awardees, Enrique Terol, who it's been a real pleasure to work with for many years. Enrique, what would you say is the key factor behind the success of the ERN so far?
Well, Vicky, after 12 years of experience in this endeavor, two elements can explain the success of an initially wishful but ambitious idea. Firstly, the idea itself, that the best specialists from across Europe could join their efforts to tackle complex or rare medical conditions so that any rare disease patient in the EU could have free, equal and equitable access to healthcare, no matter their gender, age or origin. The idea crystallized the feelings, needs and sense of opportunity and urgency of many people. And second, the strong driving force to develop the networks, the creation of the ERN community, a wise and strong community of believers, sharing the goal of looking out for the best interests of the patients, doing the right thing for the patients, using the intellect, the knowledge, the capacity, and the solidarity of different resources in the best possible way. No matter the budget, no matter the legal basis, none of this would have been possible without a community such as the one I have had the privilege of being a part of. And my own very personal reason. How many times in our professional careers can we noticeably improve the life of someone? I want to thank EURORDIS for this Black Pearl Award that I proudly share with the ERN community, ERN coordinators, project managers, healthcare professionals, experts, and representatives from the member states, and of course, for you, the patients. In particular, I want to share it with some of my colleagues of the Commission, those who had a vision beyond the common bureaucratic and institutional short-term mentality, with whom I have had the privilege of working all these years. And now I turn to Birutė. How do you see the future of the networks?
The future of ENs, of course it is bright. However, when we talk about future, we usually tend to overestimate what could be done over 1 year and underestimate what could be achieved in 10 years. And both tendencies may make us pessimistic. Indeed, if we stop for a while and think over what was achieved during the last 10 years, since 2010, it is really impressive. At that time, ERNs were not even on the horizon. In many member states, a single center of expertise still was not identified and designated, at least formally. Actually, all EU national plans for rare diseases could be quantified on the fingers of just one hand. Today, we have absolutely different situation. On the other hand, we are setting huge hopes and expectations on ENs, but we should bear in mind that it takes time, and it is not possible to reap all the sweet fruits right after planting a tree. Hence, over the next 10 years, it is hugely important, first, to take care that ERNs are able to perform their functions and ensure their long-term sustainability. Second, to take care that every person in need across Europe may access ENs, and this task relies on proper EN integration into our national systems. Finally, strong and properly supported ENs should extend the concept of networking globally. These three crucial steps will allow us to transform diagnostic labyrinths and odysseys into diagnostic highways, and to hold our promise to ensure truly universal health coverage for people with rare and complex diseases.
Congratulations to three great leaders.